As the price of just about everything rises, premiums for many healthcare insurance plans through the Affordable Care Act are set to go up as well. This news spells a headache for a lot of small businesses who are finding themselves unable to afford providing health insurance for employees. For more, we're joined on the KCBS Ring Central Newsline by Paul Seegert, managing partner at PCS Advisors. Paul, I guess the first question everybody wants to know is, how much is this going up, do you think?
Well, what we're seeing is 10% as an average across all markets. Some depends by state. Some are as high as 20%. The good news for individuals is that they will be avoiding this for the most part because of the fact that the subsidies that were put into place as part of the COVID rescue legislation have been continued with the Inflation Reduction Act through 2025. So if you're an individual that's purchasing health care through the exchanges, the government, for the most part, will absorb the increase. It's smaller employers that will, unfortunately, carry the load here, and that could have some negative consequences for some.
And what's the justification behind this? I mean, is everybody just using inflation as an excuse?
Well, I think yes. The short answer is yes. Inflation has an impact. The cost of supplies, increased costs for medical services. We've watched as an example, the cost for a traveling nurse. There was already a labor shortage for nurses and other skilled healthcare professionals coming into the pandemic, and we watched the wages for a traveling nurse, as an example, go from $1,900 a week to $3,500 a week with big signing bonuses because of this scarcity of staff. So that has an impact, and then just general inflation overall is impacting the cost of healthcare.
So what do you do if you're a small business?
Well, some small businesses, even pre-pandemic, we saw that the number of Americans that were accessing healthcare through their employers was slowly declining, and people were shifting over toward exchanges to get their healthcare, and that already was because of the fact that some employers were saying, we're doing a cost-benefit analysis and saying, look, our employees might do better if they were to go to the exchange where they might receive a subsidy in lieu of us providing health care. And I think this current situation has accelerated that and has the chance of accelerating it, where other small employers who are not required by law to provide benefits might make that same decision.
What about the services themselves or the choices of where the insurance will or will not be accepted? Do you foresee any changes in that?
Well, there are challenges there. Unfortunately, some of the plans that you can access to the exchange, when you get behind the curtain and see the reimbursement rates that they provide to the providers and the hospitals and so on, they can be less. So the part of the unfortunate element of this is that could reduce your access to care in terms of all the doctors that you're used to, the facilities that you're used to. They may not all accept them.
You mentioned big businesses as well, and obviously, I mean, we work for a big company ourselves. Do you foresee the companies using this as, I don't want to say as an excuse, but maybe as a way to up the insurance rates and encourage employees to go look elsewhere to lower their costs?
Yes, I think that could occur. That trend existed. I think it will accelerate this. Large employers, however, will be less impacted. Small employers it's the toughest part of this whole landscape because they have the least bargaining power, there's just the least power in this whole arrangement. They don't have large numbers, and they end up oftentimes getting the larger increases and just having less options when it comes to how they might mitigate these increases.
All right, Paul, appreciate your time and the information you're passing along to us as well. That is Paul Seegert, managing partner at PCS Advisors.